and welcome to this special interview on World IVF Day. On the 25th of July 1978, the first IVF baby, Louis Brown, was born in England, and since then, this day has been celebrated as the World IVF Day. With me today in the studio, I have two expert doctors who have a vast experience in IVF. I have with me Dr. Sachin Narvekar, who has done his obstetrics and gynecology MD and later on has done a fellow in reproductive medicine. And with him is Dr. Gauri Gauns. She is also an MD in obstetrics and gynecology and has been trained in reproductive medicine. Together, they had set up the Sunshine IVF Center at Vision Hospital in October 2017 and since then have been a hope to many childless couples. Welcome to the show, Dr. Sachin and Dr. Gauri. So to start off with, what are the basics of conception?
Yeah, so that's a good question. Before we start up talking about infertility, we have to know what is fertility.
Right.
So we should understand that there are two fallopian tubes on the either sides of the uterus and there are two ovaries.
Yes.
So for fertility to occur, the conception to occur, one egg has to form every month.
Yeah.
And this egg has to go through the fallopian tube towards the uterus. Now the egg cannot move. It is taken by a conveyor belt like structures in the fallopian tube which carries the egg towards the uterus, and this conveyor belt is basically the hair-like cilia that are there.
Right.
So these are very delicate. Secondly, there should be sperms available. So the sperms are deposited in the vagina,
Right.
and they travel upwards towards the fallopian tube, and there in the fallopian tube itself the process of conception starts. So the first early stages of life happens in the fallopian tube. So first 5 days the fallopian tube nourishes the embryos and then it comes in the uterus.
Right.
So all these steps have to take place correctly. Even if one step is missed,
Then
in
it
that
leads to
cycle it will
infertility.
not happen.
Right.
So if you see, every woman has got only 10% chance to conceive in a particular month. It is not 100%,
Right.
unlike expected. So if you see, within 6 months, normally about 60 to 70% women should conceive, and by 1 year 80% should have conceived.
Right.
So when we say infertility, it is the duration that is important. That means women, the men and women who have been trying to conceive for at least 1 year regularly. Now regularly means having sexual relations every 3 days. Why is this important? It is important because the sperms can survive for 3 days,
Yeah.
but the egg can
They
survive
cannot.
for only 12 to 24 hours.
Right.
So when the egg is there and if there are no sperms, again conception will not happen. So once in 3 days, that is very important. So if a woman doesn't conceive in 1 year, then that lady might have a infertility. But this 1 year is not a fixed number. We say that after 35, women should come to the doctor after 6 months of trying, especially if there is a problem like irregular cycles, or if the woman has got painful menstruation or painful sexual relationship. So
Right.
in that case, they should not wait for 1 year, they can come earlier.
Earlier.
Also, if the man has got some problems like erection or having problem in sexual relationship, then they should come earlier.
Earlier. But doctor, what is the percentage of infertility in Goa, if you see by the statistics of it?
See, overall, out of the married couples in the reproductive age group, that is between 25 to 40 years, the incidence, the prevalence would be about 10 to 15%. And of late, there might be a slight increase. This might be because of various reasons that which we will discuss surely.
Yeah.
And also because there is increased awareness. People are becoming aware that there is treatment option and there are treatment options available. So more and more people are coming for treatment.
Right. So what is infertility, or when is it termed as infertility? You know, what is the fine line between being fertile and being infertile?
So if a couple is trying to conceive with regular relationship
Yes.
for 1 year and still they don't conceive, then that is called as infertility.
So they should know when to come to
Yes.
seek help.
Yes.
So doctor, what are the causes of infertility? Is it always the female who's responsible for infertility, or there are also male related causes?
Females are responsible in around 30% of the cases.
Right.
Males also for 30%. Combined factors, which is both male and female, for the next of 30%,
Yeah.
and 10 to 20% could be unexplained causes.
Right.
So the commonest cause of infertility in women is delayed childbearing. See, we have to understand that female fertility is very much age dependent. The peak fertility occurs in mid-20s, and once the lady is around 30 years and above, the fertility gradually declines, and there's a sharp fall in fertility after the age of 37. So much so that at birth, if you consider, a baby girl has roughly around 2 lakh eggs, and by the time she's 30 years old, then this number comes down to around 45,000 to 50,000. With age, also not only the number, the quality of the egg also is affected. So we see many patients, even if they conceive after the age of 35 or 36, they also can have miscarriages. So reproductive planning in women is very, very important, because with rising age, the fertility incidence definitely increases.
Right.
In ovaries, because ovaries are the main organs which are producing ovulation every month, if a patient is not ovulating regularly, which is called as anovulation,
Right.
then there would be less chances of getting pregnant.
Which means there's no egg, so there's no
Correct.
precursor to the whole process.
Absolutely. There would be no ovulation and hence no pregnancy.
Right.
Now, the commonest cause that we see now is polycystic ovarian disease.
Right.
Okay. Now there are various causes to it, and I'll not get into details of all that. But polycystic ovarian morphology is so very prevalent, and so many young girls are coming up with this problem.
Yes.
There's another subset of patients who have a diminished ovarian reserve.
Okay.
For whatever reasons, maybe it's genetic, maybe it's congenital. Sometimes it is because of some surgery done on the ovary, some chemotherapy, wherein the number of oocytes or the number of eggs that a lady has diminished.
Yes.
And then she comes with a poor ovarian reserve to us.
Right.
The third causes could be extreme stress, patients in depression, patients with a lot of psychological pressure.
Yes.
In girls who go to hostels, we call it hostel amenorrhea, so wherein the ovulation again is disrupted. And in certain endocrine causes which also affect ovulation, like hypothyroid, increase in prolactin, these also can cause disruption in the ovulation.
Right.
So these are the major causes as far as the ovary
Ovaries
is
are concerned.
concerned. And of course, yes, I forgot about endometriotic cyst, which is
Yes.
also very common now.
Right.
So endometriosis in the ovary causing a chocolate cyst will also decrease
Result in-
the ovulation, decrease the quality as well as the quantity of the number of eggs that a lady
Right.
has. In tubal causes, by far, India had a large population of genital tuberculosis. So many
Right.
women with genital tuberculosis had difficulty conceiving, and they had badly damaged tubes which
Right.
required IVF. But nowadays we see a lot of endometriotic patients having damaged tubes, which also causes infertility.
Right.
Past history of any sexually transmitted infections which can
Infections.
cause tubal damage, which is permanent, can
Yes.
also lead to tubal factors.
Right.
And thirdly, the uterine factors, things like fibroids. Now, not all fibroids cause infertility, but the size, the location, and the number of fibroids matter when we decide whether the fibroid is a cause of infertility. There could be polyps in the uterus, in the
Right.
endometrial lining.
Yeah.
There could be adenomyosis, which is the swelling of the uterine wall, which is irregular and it is not a normal atmosphere for the embryo to implant.
Yes.
Or it could be a genetic defect wherein the uterus can have a septum.
Yes.
Septum wherein the cavity is divided,
Divided.
and this also causes problem conceiving.
Right.
Lifestyle also plays a very important role in one of the causes of infertility. Sedentary lifestyle with obesity is so very common, and obesity directly causes infertility in many other ways. So also there's something called as endocrine disrupting chemicals which can interfere with the normal hormonal process in our body.
So doctor, this was with regards to the female causes of infertility. Now what are the male causes of infertility?
Yeah, that's a very important question, and it's very relevant, because when infertility is the issue, the male always steps back.
Yes.
He says that it's not
always
my
blamed
problem,
on the female.
it is the woman's problem.
Right. Right.
But
right.
The male factor is also very important.
Yeah.
And nowadays we are seeing many men who are having less and less sperm count. One could be obesity. The one reason could be obesity. And obesity causes a hormonal imbalance in male. There is more of estrogen, which is a female hormone. So that causes decrease in sperm production. Another cause could be increase in temperature in the testis. Now the testis is outside the body. It is below the trunk.
Yeah.
The nature has provided it like that so that the temperature is at least 1 degree less than the body temperature, which is 37 degrees.
Right.
Now if the testicular temperature increases, then the sperm production is going to come down.
Yes.
So there are some reasons why the temperature can increase. One is varicocele. Now what is varicocele? Varicocele is basically the enlargement of some veins around the testis.
Okay.
And when the blood flow increases, as our blood is warm, that causes increase in the temperature. Other causes of increase in temperature is the exposure to heat. Now we find that many people who work in factories with furnaces, they have a low sperm count.
So that could be occupational hazards.
Yeah, drivers who drive for a long time, they have less sperms because of the heat generated there.
Right.
Or policemen who stand in the hot sun, they also can
Strenuous
have
activities.
a less sperm count. Another factor is exposure to pesticides or other toxins. Now we
Yes.
find that many farmers who come to us, they have low sperm count because of the exposure to pesticide. So that is one important issue.
So, doctor, how do you evaluate, infertility in males?
See, when a couple comes to us, the first thing that we evaluate is the male partner. And it is important that both male and female should come in at least the first visit.
Right.
So in the males, we do something called as semen analysis. Now semen analysis is basically done after 2 to 4 days of abstinence. And in that we see under microscope how the sperm mode looks like, what is the quantity of the sperm, and whether the sperms are adequately motile.
Motile.
As I said earlier, the egg doesn't move, it is just carried forward.
It's stationary. Yeah.
Yes, but the sperms have to go and meet the eggs. So if the motility is a problem, then there
conceiving
will
is a
not
problem.
be fertilization and conception will not happen.
Right.
So many a times we find that the motility is the issue.
Okay.
So semen analysis is the most important test and is the only test that is actually required
For
in
a
the male.
male.
Yeah.
Yes.
And besides that, we have to also see the general health of the man.
Right.
That is also neglected, whether the man has diabetes, because many men who have diabetes have low sperm counts.
Right.
Obesity is another factor, as we talked about previously.
Yeah.
And other diseases, which can hamper him from having a sexual relationship, like hypertension. The man maybe wants some medicines which are not allowing him to have proper erection.
Right.
So that can be the cause.
Absolutely.
Yeah.
Dr. Gauri, what are the causes? How would you evaluate a female for infertility?
The evaluation starts from a detailed history. The patient's menstrual cycle history is very, very important for us to come to a conclusion whether she is ovulating or not.
Right.
The duration of the flow, whether she has associated painful periods, whether she has painful intercourse. Then on examination, we try to see her body mass index, her weight, any signs of thyroid abnormalities, thyroid swelling.
Right.
And on a normal checkup, we check for the ovarian function, the uterus, and the other biochemical checks. So in ovaries, we like to know the ovarian reserve.
Right.
Ovarian reserve is a number of follicles or the number of
Follicles,
oocytes that the
oocytes.
lady has. For this, we resort to a transvaginal checkup, wherein we see something called as the antral follicular count, which helps us to understand the ovarian reserve of the lady.
Yes.
This is also supplemented with a blood test called as anti-Mullerian hormone, which is a biochemical investigation to know the ovarian reserve.
Okay.
On the transvaginal sonography, we also check for the uterus, its normal size, shape, and endometrial thickness assessment is very, very important. We like to see a good triple line endometrium in the mid part of the cycle.
Right.
And of course, we check for the adnexa, any adnexal mass, any chocolate cyst, any irregularities in the myometrium suggestive of adenomyosis.
Yeah.
And the other blood investigations like fasting blood sugar level, thyroid levels, prolactin, and infective diseases like HIV, VDRL, hepatitis B. So all the serological markers are also
Markers
done.
have to be done, right?
These are the basic investigations.
Yes.
And of course, as when we start treatment and if the patient doesn't conceive, then there are certain other set of investigations. Which come in later. So you see, it's a step-up evaluation. All
Right.
the investigations which are done are not done upfront.
Upfront.
The next line of investigations become a hysterosalpingography or a sonosalpingography,
Yes.
which helps us to diagnose whether the
tubes are
fallopian
patent
tubes
or
are
not.
patent or not. which is so very important when you actually decide about the next line of treatment for the couple.
Dr. Sachin, what is the treatment of infertility in males?
Yeah, so we have to assess the overall health of the man. Like if the man is having some problems like diabetes, hypertension, we have to treat it.
If there are any comorbidities?
Yes, comorbidities, then we have to treat it. Now, as far as the sperm count is concerned. If the man has got a varicocele, as we talked about varicocele earlier, there is a treatment for that. If it is a big varicocele, then sometimes we do treatment for that. That is called as varicocelectomy. Then medical line of management is very less, because mostly it is the antioxidants, vitamins that we give, and it doesn't help
boost
much.
The sperm count.
Yes. If the man is having some hormonal problems, like we do something called as FSH, or that is a blood test, or LH. If it is less, then the man can be supplemented with some injections.
Okay.
But that is a very, very few people who are having that. Then other aspect is about the sexual relationship. The man has got some problem in erection and they cannot have proper sexual relationship. Then for that also we have treatment for that, and it is like it's quite effective for that.
Correct.
Yeah.
And Dr. Gauri, what are the treatment that you would recommend for females who have been diagnosed with infertility?
When we consider treatment for female, there are three things.
It's a wide
topic. We always think of various factors when we decide upon. The most important being the age of the female, as we already discussed before. Age becomes a very important factor. Second is the duration of the infertility, and third is the other coexisting factors, whether it's a combined causes like a male factor as well, whether it's a tubal factor. So all these factors are taken into consideration.
Right.
If a female is less than 30 years, relatively no other factors which we see on the initial checkup, we always start with basic ovulation induction, wherein drugs like letrozole or clomiphene citrate are given for 2 or 3 months. And of course, this is done with proper follicular studies, wherein the patient comes in 2 to 3 times a month for follicular monitoring. And then they are given medicines in form of progesterone tablets as luteal phase support. Of course, if 2 or 3 cycles...
what you're talking is about ovulation induction.
This is called as ovulation induction, absolutely right. And after maybe 2 or 3 cycles of ovulation induction, if the patient is still not conceived, then we think about more investigations like an hysterosalpingogram or sonosalpingography. And again, if depending on the couple's age and the other factors, then we decide whether we still pursue with the same treatment, whether we add some more medicines in form of injectable gonadotropins. And then in case, in spite of all this, if a couple still doesn't conceive, then we think about the further treatment, like IUI may be the next step for this couple.
So Dr. Gauri, what is IUI and whom would you recommend it to?
IUI is intrauterine insemination. This is a technique wherein the husband's semen sample is processed using certain special methods like a double centrifugation method or a simple swim-up method. And this processed sample is instilled in the uterine cavity with the help of special cannulae. So IUI is recommended, or it's done for patients who have maybe unexplained infertility, mild to moderate male factors wherein there is oligospermia. And in patients who have tried simple ovulation induction before and they haven't conceived. And the patient's age should be less than 40, but for IUI. We generally don't recommend IUI for patients more than 40.
And Dr. Sachin, what is IVF and for whom is it recommended?
आम्ही पहिली उलयल्या fertilization म्हणजे union of the egg and the sperm, and this happens mainly in the fallopian tube. But in some women, this does not happen, the union of the egg and the sperm. In those patients, we do in vitro fertilization, that is the fertilization in the laboratory, in a petri dish. So, in which patients we do this? Women with blocked fallopian tubes, in vitro fertilization is advised. Or if the sperm count is very low or the motility is very less, in them also in vitro fertilization is advised, because the sperms cannot go and meet the egg. They are not motile. So IVF is advised in them. So what is IVF? In IVF, we stimulate the ovaries with injections and make them grow lot of follicles, that is lot of eggs. And these eggs are then retrieved from the woman's body through the with a needle which is passed through the vagina under anesthesia, and these eggs are then aspirated one by one, and then they are taken in a petri dish, and under high magnification these are mixed with the sperms and allowed to fertilize and then grow in the carbon dioxide incubators. So this growth is done up to 5 days, and after that these embryos which form are then transferred into the mother's uterus. Now there is another process called as intracytoplasmic sperm injection or ICSI. So men with very low sperm count or with no sperms in their semen, they also can conceive when IVF is combined with this process, that is ICSI. So in men with very low sperm count, the sperms are taken in a microneedle. You can see in the video, the sperms are taken in a microneedle. The oocyte is held with a holding pipette, and then the sperm is directly injected into the oocyte, and this helps in fertilization and creation of healthy embryos, and this has led to development of healthy babies. Also, men with zero sperm count can also conceive. We can obtain the sperms directly from the testis by making a small incision or by putting a needle through the testis and then taking them and doing ICSI. So in whom IVF is done? So first we spoke about blocked fallopian tubes, second is low sperm count. But nowadays IVF is done when other treatments also fail. So we have spoken about ovulation induction with timed intercourse, wherein medicines are given to the lady and then they are asked to have relations in those times where the egg forms. Suppose that doesn't click for them, then we do the next procedure, that is intrauterine insemination. That is, we take the sperms and inject directly in the uterus. But if this also doesn't work after 4-5 times of trials, then again we do IVF. So the indications for IVF has expanded nowadays, and IVF is done very commonly for infertile couples.
Right.
There have been a lot of technological advances. Our knowledge has improved, and we have been able to achieve better success through IVF. Another advance is that we can now freeze the embryos as well as the sperms for n number of years. Now, how this freezing process has helped? So when we develop embryos in IVF, we transfer 2 or 3 embryos at one time. But if the woman has developed about 10 embryos, then what happens to the rest? These are then frozen in liquid nitrogen at -198, and when required, they are thawed back to life and they remain viable, and this has given us healthy babies. So that is one important development that has happened in IVF, that is cryopreservation of the embryos. This cryopreservation can also be used for women who want to postpone their pregnancies for a longer time. When the embryos are cryofrozen, the age of the embryo is the same as the age when they were frozen at that time.
Okay.
So IVF has also helped women who are undergoing treatment for cancer, because the eggs can be frozen in time, and then after the completion of cancer therapy, these embryos or the eggs can be used for having a child. So in the last 44 years, millions of babies have been born through IVF, and the health of these babies have been constantly monitored, and we have a lot of studies which say that these babies are healthy.
Okay. Dr. Gauri, what are the success rates in IUI?
In IUI, if a patient's age is less than 30, the success rate is around 15 to 20%. With increasing maternal patient's age, the success drops to around 10%. Versus in IVF, the success rate can be anywhere from 35 to 40%. And if a patient is doing another transfer after one failed cycle, there's something called as cumulative success rate, which can go even up to 45 to 50%.
Dr. Sachin, is IVF more effective than other treatments in conception?
See, as we spoke earlier, there are different types of treatments, from medical treatments to IUI. But in IVF, what we do is we put the embryo directly back into the uterus. It is
Right.
like, you go to a nursery. They might give you a seed that you plant, but the seed may not grow.
Not grow.
But if they give you a small plant itself and you then grow it, there is a higher chance for the plant to grow. So in IVF, we directly put the embryo, which is already growing, back to the uterus. So in that, only the thing that is remaining is that it has to implant. That is the important factor, implantation.
And
once
then further
and
growth of the
Yes.
embryo.
So that implantation we don't have any control, because that is up to
Right.
the body. We can optimize it
Yes.
by giving hormones, by optimizing the health of the lady. We can optimize the implantation.
Right.
But then it is not 100%. That is why IVF, we don't say that IVF gives
It's a
you
foolproof
100%
method,
result.
yes.
Yeah.
So, Dr. Sachin, what would be your take-home message to improve fertility in males as well as females?
So I would like to say that reproductive planning is very important. Nowadays, the age of marriage has increased. The age at which the first child is born is also has increased.
Yes.
Age is one important factor.
The take home message is very simple. Infertility not always requires medical treatment. We have to always remember healthy lifestyle, eating healthy, exercising regularly, preventing obesity goes a long way in improving our reproductive health.
Right.
I would also mention here about something called as endocrine disrupting chemicals,
Right.
which are everywhere. They are prevalent in our food that we eat, the water that we drink, the
Yes.
storage containers that we keep our food in.
Yes.
So these endocrine disrupting chemicals are something very similar to the estrogen hormone in our body, and these are causing conditions called as hyperestrogenemia, wherein they're increasing the estrogen levels, they're mimicking the estrogen hormones, and these have been responsible right from breast lumps to uterine fibroids to endometriosis to polycystic ovaries
Yes.
to neurodevelopment defects,
Okay.
and these are something transgenerational. They can affect from the mother to the offspring
child.
and to the third generation as well.
Yes.
So I think being in this field, it is very important that we convey this to people. Ki going back to our roots,
Yeah.
going
Like
the
the simple
healthy way,
things, yes.
going the simple way of life is very, very important.
So, Dr. Sachin and Dr. Gauri, thank you so much for coming to the studio and enlightening us on so many different aspects of fertility, infertility, and the treatments of it. Thank you so much for watching this special interview on World IVF Day. Keep watching Prudent. Thank you.